Good afternoon, and most importantly, congratulations to the class of 2020. It has a great sound, it's a great moment, and I want to express my thanks to Dr. Montgomery Rice for your introduction. This is really a great honor and privilege to come home, even if it's virtual, to come home to Morehouse School of Medicine. I've been a lot of places, I've been at a lot of convocations, but it's always special to come back to the Morehouse family as part of a historic moment in which we pass the torch, the baton, to a new generation of graduates this year. I especially want to extend warm greetings to those who make all this possible, particularly the families and the friends and those faculty who've supported the class of 2020's journey through these last several years. It couldn't have been done without you, and they're watching virtually in this country and around the world. Today's convocation may not look or feel the way you envisioned it several years ago, but it is nevertheless an important milestone. It's a year that will be like no other, 2020, in which this is a great celebration of what you have accomplished. Part of that theme is to celebrate that resilience that has been molded and imprinted and instilled in you by the Morehouse School of Medicine during your journey that will last a lifetime as you address adversity and challenges that are yet to come and seize the unprecedented opportunities that are on the horizon for you to grasp. Indeed, that's what the Morehouse School of Medicine is all about: promoting resilience in the face of adversity to turn challenges into opportunities. Indeed, that is embodied by the legacy of giants that have built the Morehouse School of Medicine that exists today, starting with its founding visionary, Dr. Lewis Sullivan, came from humble beginnings in Georgia to become Secretary of Health and Human Services, as well as luminaries such as David Satcher, Nigel Harris, Peter McLeish, and others. You're standing on the shoulders of giants, and that's what's going to enable you to seize unprecedented opportunities and turn challenges into opportunities, to build on that resilience that has been invested in you by the Morehouse School of Medicine. Indeed, this tradition, this ritual of convocation, this gathering goes back centuries to a number of noble professions, such as the priesthood, the academy, and certainly professions like physicians. And indeed, it is this rite of passage in which one generation anoints another to carry on the special calling that brings us all together. It's that shared sense of calling that we all dedicate ourselves to in this noble profession. It is part of coming together that we, in this special moment, are reminded to rise to the challenge of community that cares. We're in the midst of a historic pandemic caused by the SARS-CoV-2 virus and devastating COVID-19 disease that's ravaging our communities. Indeed, it's laid to bear the challenges of certain populations who are underserved, certain minority communities that have been devastated and disproportionately burdened by this virus. It's revealed the social determinants of health. Indeed, it is a call and a challenge to who the Morehouse School of Medicine is, its very being, why it exists. And the class of 2020 is being called to rise to that challenge, created by this particular moment in history. If the community ever needed the Morehouse School of Medicine, it needs you now. And we anticipate that you will rise to this challenge, seize the opportunity to lead and make a difference as the prior generations, the prior classes have, and the leadership has instilled in you. So we look forward to the Morehouse School of Medicine playing a leadership role in not only this crisis, but other challenges that are to come in addressing health inequities, promoting health equity, and ensuring that we turn discovery science into the health of all, not only in this country, but around the world. Indeed, whether you're a scientist working at the research bench, or you're engaged in community-based settings and community-based participatory research, we believe that you can make a difference and be part of the solutions. So as you answer this calling, it's been my experience that your journey will often relate to those people who intersect your path along the way. It's those people who influence the trajectory and the direction that is going to be most critical. It begins as part of a circle. It starts with your family, your peers, patients, teachers, mentors. At the end, it's not about grades or scores or publications. It's the people that you touch as part of your calling that will make the lasting difference. So I will hasten to the most important part of this convocation. And I won't keep you long, but I want you to keep two takeaways in mind as enduring principles and challenges to you. Cherish your calling of caring and commit to continuous curiosity. And I pray that you'll hold on to those two enduring principles. I'm inspired to think about those principles in remembrance of a member of my family who set me on a certain path. I recall my grandmother. She's germane to this audience because she was born in the latter part of the 19th century in rural Georgia. So more on the east coast of the state. She was just a couple of generations removed from slavery. The daughter of a sharecropper, very modest means. At that time, the nation, the state of Georgia, placed such a low value on the life and prospects of a little black girl that an education beyond elementary school wasn't even provided as a normal part of life. And so she didn't get much education, but she was very bold and visionary. Yes, she faced a lot of adversity and challenges, but she also had certain properties of resilience to rise to the challenge and make it an opportunity. And so she struck out from that rural community in Georgia to go to a place, Philadelphia, that she could only imagine that was going to be even more uncertain. But she was bold enough to pursue that vision, had that courage to actually strike out alone. And with her then son, my father, to start a life in which they would pursue a dream in which her son and her grandson would have educational opportunities that she could not even imagine. I suspect that there might be a story like that amongst the class of 2020. And indeed, she taught me a work ethic like no other. related to her education, she was a maid, a domestic. She cleaned other people's floors and laundry all her life. Into her 70s, she did that. Didn't take a day off of work. In fact, the only time she would take a break from work, not to watch our basketball game or our football game, but whenever we were getting an educational attainment, something she never had the opportunity to get, that's when Grandma would be there. And so when I come to a convocation like this, I remember my grandmother. That moment, it's probably one of the proudest accomplishments of my life, was to take her to the convocation at Princeton when I graduated and got my undergraduate degree, and Harvard Medical School when I received my MD, and to see the look that my grandmother had. I suspect there are members of class of 2020 who are experiencing that today. She taught me and made me commit to three things: to love God, get baptized, to love my neighbor as myself, and to learn and get as much education as I can. And I like to believe that I've been faithful to my grandmother's promise. Those are three enduring lessons that I think paved the way for me to pursue my calling and to do what I'm doing and living the dream that she had for us. I might add here that I suspect that might be true of your president and dean, Dr. Montgomery Rice. Now, because this is virtual, I'm going to tell you a little secret. I don't know if she's ever told anyone at Morehouse School of Medicine, but she and I both went to Harvard Medical School. And back in that day, medical students could serve on the admissions committee. And I was on the admissions committee when this young Georgia peach came in applying to Harvard Medical School named Valerie Montgomery. I was in that position to intersect with her life journey and influence that trajectory. Now, again, I hope you'll keep this a secret. I'm probably disclosing this for the first time. Dr. Montgomery Rice, as you know, is impeccable in her attention to detail. There is no hair out of place, no part of her dress or clothing or her house is something that is in a magazine. It is so impeccably designed and in place. So you're used to your president and dean being flawless. Without getting too far into detail and disclosing confidential material, I should tell you the secret that her transcript was not perfect. And so it wasn't a slam dunk she would get into Harvard Medical School. But it was clear that in her upbringing, as a resilient, determined young black woman from Macon, Georgia, that whatever she put her mind to doing, she was going to accomplish. She had learned that resilience that takes challenges and adversity and turns it into opportunity. And so it didn't take much of a pitch to the admissions committee to say that we needed Valerie Montgomery to be at the Harvard Medical School and to put her on a trajectory to be one of the nation's leading academic leaders. As you can see, she's fulfilling that mission and that dream. But don't tell her I told you about her transcript. So what I also would like to convey is indeed this notion of a perpetual pursuit of understanding as part of that continuous curiosity and your commitment to be lifelong learners. I am a physician scientist, and it's particularly important that we are continuously learning. Again, nothing like this particular episode of a novel coronavirus that is devastating our nation and our world. And it's revealing our ignorance of how it works, how it affects the body. We're learning something new literally every week about what this virus does to the human body. And literally every week we are challenged to define better treatment strategies to enhance the lives of those who are affected and reduce the case fatality. The class of 2020, you're having an unprecedented life lesson in responding to a public health crisis and turning science into the health of the nation. I hope and I challenge some of you to take this adverse circumstance and develop innovative strategies that can help the communities that you are committed and called to serve. It comes from just simply continually asking that question, why? That was actually my motivation when I was a first-year medical student at Harvard Medical School. At that time, a public health concern was the prevalence of cardiovascular disease amongst African American communities, driven in part by the high level of risk factors such as high blood pressure, hypertension. And that was when I approached my first year Harvard Medical School professor, Dr. Clifford Barger, and asked him, why are African Americans disproportionately affected by high blood pressure compared to others? And being a shrewd professor, he turned that question back on me and challenged me to seize the opportunity to answer that question, and invited me into his laboratory. Again, it's about the people you intersect along this life journey. Long story short, he invited me into his laboratory and I was bitten by the bug of scientific curiosity, discovery. I knew I had to do that for the rest of my career. He saw something in me that I did not see in myself. And as a result, I have the privilege of talking to you now as the director of the National Heart, Lung, and Blood Institute, with a budget of over $3.5 billion, 2,000 employees. And we're in the middle of addressing the heart, lung, and blood effects of this COVID-19 pandemic. I believe this is part of my calling, my purpose. That's why I'm here, having graduated from Harvard Medical School in 1984. It then begs the question, what is driving, what is the passion of your calling? What is the dream that you have that 5, 10, 20, 30 years later, you hope to be living as I'm living mine? So let me close by this notion that indeed you are at the beginning of a series of unprecedented opportunities that I hope that you will seize. Again, this current pandemic being a great exemplar of what is possible. We need you to address how this virus is affecting the underserved. That is indeed the motto of the Morehouse School of Medicine, to serve the underserved. What is the class of 2020 going to do? You are at a part of medicine where it's becoming an information science. Indeed, we're all carrying these mini computers around in our pockets. We hope that you will be part of the generation that's going to enable that penetration, that even if you were virtual, we could still do our calling of care through telehealth, mobile technologies. We could actually monitor symptoms, diagnose disease, promote interventions, whether community-based or in the hospital, collect data on vital signs and other diagnostic information. You are part of a generation with machine learning and artificial intelligence algorithms that will help us discern patterns in an X-ray or a molecular profile that will give us risk stratification, whether it's someone who's COVID-19 positive or has hypertension. You are part of a generation where an individual living and born with sickle cell disease, that we'll have the technology to literally take the molecular scissors of gene editing tools and put that in, just like an IV, with homing capabilities to go to the bone marrow to correct the genetic mutation causing sickle cell disease and ensure that the right cell gets that information in a safe and effective way, such that the sickle cell mutation is changed back to normal and that individual lives a normal life with a day hospital visit with little toxicity that could happen in a rural community hospital on the east coast of Georgia. Yeah, one like my grandmother came from. And we're committed that her grandson is part of launching a program to make that possible. That's why this is an incredible journey. And I'm living the dream that she envisioned. I look forward to you seizing opportunities like that that are unprecedented and that stand as opportunities for the class of 2020. So I hope you'll hold on to those two enduring principles of cherishing the calling of caring and a commitment to continuous curiosity, and are ready to rock the world, class of 2020. It's waiting for you. It needs you. It's waiting for the resilience that the Morehouse School of Medicine has molded and instilled and invested in you to pursue that calling and make a difference, like all those who come before and the giants whose shoulders you stand upon. God bless you, and we wish you the best. Thank you for your attention.